Hello and welcome to Le Pub Scientifique, the Pain Podcast. And today, Bart and I are going to discuss the subject of language. So we're going to talk a little bit about narrative, stories, metaphors, the good, the bad, the ugly, and see where we go with that. So let's start with, I suppose, I mean, I was going to say, let's start with an easy one, but I'm not sure it is so easy. But what I'd love to just hear is your thoughts about why listening or being open to someone's story is important to you. That's the caveat, is that I believe that it is already. So yeah, can you tell me a little bit about your thoughts around that?
About why listening to the patient is such a vital
part. and what it is about their story.
Yeah, we decided to take it along the language and the narratives that people I think we just have to appreciate that pain is a fundamentally in the private subjective experience that lacks objective verification, right? So since there is any tests around that can confirm the existence or even the severity of pain, that individuals with chronic pain they just have to totally rely on their language or communication, or expressions, if you like, take it a little broader. So listening, I think I will be carefully watching and listening. And apart from listening, it's also checking in with the person, how you think they understand or they expressing it, whether you see it, trying to come on board and being on the same page, because their expression could have multiple, basically, well, there could be different reasoning than you thought in the first place. So I think there's a listening and carefully watching, so the nonverbal communication is such a important first step in the process, and that's why I think it's because it makes us dependent on language, right? In large extension. So especially in chronic pain, I would say. I do think in acute conditions there is more homogeneity, more like an expected behavior, if you like. It seems to be more coherent in most situations. But even that may not be true at all. But but when we see people going through ways of cope with pain conditions or experiences, that I do think we just have to try to understand better. And language is a critical first part of that.
Yeah. And we've got a little part to extend this, but I just wanted to share an experience from recently. But I had someone that I was assessing for the first time, and they were saying something along the lines of, it feels like this. I've never experienced that in reality, but it's the best way that I can make sense of the experience that I'm having and be able to share that back to you. And I said back, I was like, I mean, that is just incredible insight, that your awareness of your language and how you're using that is incredible, isn't it?
Absolutely.
But that's essentially what people are trying to do, is trying to find that sort of shared language, aren't they, of a way of communicating what they're experiencing.
Right.
So with that in mind, as a listener, I'm guessing it's a skill that you've developed over time as well. Are there certain things that you do that allow you to do it better?
You mean the listening?
Yeah.
Yeah, probably. I would say the first thing probably is open questions. It's probably a very common advice, I guess, but it's quite hard actually, because it gives you a feeling of losing track or control over the situation. People start rambling or their narratives, and things may not going in the following order. So if you feel comfortable in a logical order of events that people started to talk about what they feel today and that they may have experienced from the past, and it can be quite distressing for you as a therapist to go through all this information, which is all important, but it's maybe not in like the detail of it, but it's in the story and the narrative itself. You're trying to make sense of the story and it's within the history and when things are happening today. Although we are heavily biased, though, but I'm trying to open questions, paraphrasing. Did I understand it correctly? That, or can I summarize this for you? Or sometimes a little bit provocative and giving. Telling when people are giving you an idea of that, I've tried it all, nothing works. You obviously, as a clinician, would say, why are you here? Because obviously they haven't tried everything already, or they might there for a reason. So being slightly more provocative to say, well, this is not what I mean. This is actually what I mean. So people can have an opportunity to clarify, and they need some help, obviously, to basically get it out there and get you understand it correctly. And I think that's it's apart from just communication, it's also connecting with the patient. And the other thing is that I think you have to at least try to give the person the feeling that there is enough time. There may be 20 minutes, but I think in many ways 20 minutes might be sufficient for most of the stories, or at least parts of it. So giving people that space to do a deeper dive. And another thing is that sometimes I'm just from a language perspective, we're as patients, but we're as well, we're also biased towards what are your questions. So your major questions probably, if you're just going to ask, tell me about your history, and they are worried about what happens today, you just have to check in what they're because they wouldn't be too interested in the past, I guess, when they're actually worried about something that happened yesterday. So I think it's also what is it the thing, like an open question, but it's I'm already guiding towards, well, strategically making sure that we hitting the right buttons to engage the patient within this conversation, because otherwise it will be a very, I would say, corporate conversation that is very structured, but there's no feeling of, yes, I've been heard. You may have asked all the questions, but you didn't pinpoint what was actually the most important thing at that stage where this patient was. So maybe that's probably were the couple things that I would do to improve it.
So, and then you sort of mentioned an interesting one, and in fact, you've got a couple of ideas, I suppose, we can explore from this. Is there are times when a story does have sort of an unusual, unpredictable to and fro, within the story itself, and it looks a bit chaotic as well, doesn't it? So, which might look very different from someone who can give you a very distinct time frame and progression of what they've experienced. How do you feel about those sort of, I mean, that's two examples here, but how do you feel about those two, and what does that give you some ideas? Does that tell you a little bit about that person and what they're experiencing?
Yeah, of course. And that's a great question. And I may not have the right answer there, but it gives you at least a starting point where when a story is chaotic and there are even there's even the contradictions within the story. You don't want to blame someone, but they're actually, perhaps even they're already organizing their thoughts whilst they sitting next to you. I'll just leave people like by giving some questions, or sometimes like recapping a summary. Actually, this is what you said, but this contrasting the other thing you said. So I was just, how is your How do you feel about that? And I said, that's right, indeed. I'm just worried about it. So I need another X-ray or a new MRI. But I just had the one before and I felt quite comfortable. It was okay, but today I don't. And that's why is that? And giving an idea of, like, these follow-up questions are very important. So I wouldn't say that open questions lead to like all the information you need, but you also have to pinpoint the contradictions and their. I can see when you talked about this specific subject, I saw that you were, it certainly made a difference to compared to the other part of the story. So how does it fit emotionally? What is your thinking about it? And I think that's probably an opportunity where you can see how things during the story actually really matter. I'm not sure if I answered the question, by the way.
Yeah. Well, it sounds like, so what I'm hearing, paraphrasing back to you,
Yeah, exactly.
is that there are times when you opened up a subject, but there are times when you want to close it down as well, and be quite precise and direct. Yeah. So like you said, as an example, just to just to sort of sort of pinpoint where we're at. If someone gives an impression of being scared about something, it's helpful to sort of drill down sometimes and see whether they know what it is that they're scared about and why it is.
Yeah, and it's also there are in, let's say, people seem to use different, especially in English and in Dutch as well. There are very common pain experiences, that metaphors that reference like a familiar painful sensation, like electricity or sharp or shocking or electric. So that's, I would consider that to be highly clinically relevant, because it gives you that diagnostic information potentially, because there is quite a strong overlap in people how they experience radiation, for example. So we have to take it seriously, but also have to, because it's a metaphorically, you have to carry that out very carefully and do the next step. So what is actually what you mean? Where does it sit? And basically give it like another follow-up. And other people like having these more invasive metaphors, like insects, or it's like ants are walking around in my leg or in my arms. There are, it's like
One of my
biting.
favorite words, that is formication, isn't it?
Yeah, totally.
Which,
And what I'm particularly really interested in is bodily misperception, or maybe that's not the correct word, but it's like people have a perception of my head or my leg feels like it's blowing up, or it's like huge. The spine and how it's been horned, or how they experience their body is really interesting how that goes. And it's, I think, especially these bodily misperception or perception of the body in it's quite easy to dismantle that in a way, because you're going to watch it and it's not there. And people do understand that, but this is the feeling they're trying to. So I think these follow-up questions are so important, where you can actually dive deeper into what is actually what you mean when you say your knee is blowing up, which gives you an interesting, because it might be, yeah, it's red and swelling, or actually we have to check it out, right? Probably. And otherwise you might have to check it out as well, not to find this potential inflammatory response, but you can take this language to like a follow-up action, not just another question necessarily. And I do see some people you can see when pain is a fight, or it's like war. And um, this is also quite well described in the literature, where when there's a fight against cancer, a fight against pain, fight against disease or whatever. I do think it doesn't really fit into the narrative of treatment. Um, so there's not many treatments that fight pain very effectively. We all seem to be quite more comfortable with being, or strategies and coping mechanisms, and finding better ways even stop fighting because probably it's not even sufficient, it's not even helpful. So in many ways, fighting is something is deeply entrenched within the language, but it's when we go to therapy, there's a bridge to gap. And I think that's something, again, where you can have a good, it's a good example where I think you can see where the patient sits if they're fighting something and you're trying to learn to live with it. That's probably highly problematic because you're on from a linguistic perspective, you're in a different universe. I think that's something you have to take care of.
So what you're giving us is a few examples of distinct sort of metaphors, or so ways of someone being able to share their understanding of what they're going through. Do you think those metaphors are embodied as well? Do you feel, so say someone feels like they're in a fight, or do you think that's also something likely to find within their body, the sense that their body is sort of, what would that be? Would it be tense, or would it be that the immune system is revved up, or what, is that, are we likely to see these things in correlation with the language that they're using as well, would you feel?
Yeah, it's going to be highly problematic to identify this like as a classifying it with a diagnostic test, obviously. But what I do think from a clinical point of view, people like feel fighting and how the fighting is represented in behavior, for example, if they just holding their breath and they literally fighting back and just holding and squeezing it, and then actually is bearable, right? And during therapeutic approaches that allow them to release and then having, let's say, a different experience with, and it's actually not that bad as they thought it would if they would let go. So for example, relaxation doesn't necessarily have to be disastrous if you tried it with guidance. I think that's kind of an interesting thing because it's the language tells, it's the language, and maybe if it's embodied and you can flip it around within this session to give an alternative, and actually the fighting, and that's also a metaphor, like give up the fight, right? So you're treating the metaphor rather than the enactive feature of it. It may be, but I think that's probably our reasoning as a therapist. I see this person doing this, this, and this, and that looks like fighting, and that's the linguistic explanation of it. And then we're trying to let people experience that not fighting is also a potential good pain, ease the pain, or controlling it, or being more in charge, or give it a name. But it's such an interesting part when I think we do treat a lot of metaphors, by the way.
We talked about acceptance in a previous podcast, haven't we? A couple of podcasts ago, and the challenges of that as well, of the idea of letting go. But like you say, that maybe that sort of the way that you view what pain is and what's happening in your life, that maybe that's that idea of treating the metaphor of allowing something to let go of the fight in that sense would be helpful for many people. I'm just thinking about some of the sort of classical, I think maybe current metaphors that people are using. I hear a lot of people talk about an alarm system, for instance. So, and I think there's value in that. I had a patient actually describe this to me the other day. It's like my body's on high alert. It's like, and I feel like that's, they've done a really good job to notice it again. Like, well done.
Yeah.
But it's often a metaphor that's given back to patients from therapists as well. Is there ever times when, like with good intentions, but that can be misconstrued? Can it go the wrong way? Like, how do you feel about the
Yeah,
use of metaphors then here as a therapeutic tool?
yeah, yeah. Oh, that's a great question. As I probably I'm just referring back to my clinical work, whereas we see people in long-term painful conditions when they have obviously collected different metaphors and using them, like mixing them up, and some of them make sense. So I basically asked them, so which one does make most sense to you? Which do you feel most comfortable with? Because it's obviously a way of expressing it, and it's not the way. There are probably other ways or multiple ways to do it. What I found challenging, and it's something as a therapist, I think a metaphor is there for giving an explanation at least, or an understandable explanation, and it should add to the understanding of the patient, that they should be able to wing it after that. But there is a risk of that we present our preferable metaphors, and I think therapists do feel comfortable with the alarm system because that's our story. I think you just have to be careful. If people, and like your patient, Tim, if that patient comes up with with the alarm system or feeling on alert, and they may have picked it up somewhere from a clinician already, but they feel comfortable, that will be a reason for me definitely wing it with the alarm system and see that's probably what they already have adopted. And whether I see the pros and the cons in that. But it's quite hard to find a new one, or even if you just bring up your own preferable, sometimes it just doesn't work. I don't think it's bad if it doesn't work, but check in with the patient whether you think you can see, do you get what I'm trying to give you? Like, and I'm very explicit about it. I'm just giving you a metaphor now.
Mm.
This is not the scientific truth, but there are ways to make it work. And probably this picture or this language or this story that could give you some understanding of the complexity, what's going on, and make it more, at least, understandable for your situation. And I believe that's probably a good thing to do, but I think that's why this listening part is so important. You can hear their language and their potential preferred metaphors already there. So I think as a clinician, you probably would go, if you're comfortable with it, you're probably gonna use that prior information to refer back, and that's somehow helpful. But sometimes it's not, right? So it's overcomplicating things. So yeah, and there's no, and it doesn't matter if you tried it and it didn't land well. Just apologize. Oh, sorry, I just tried to give you an explanation that might be helpful, but certainly I did a great job in doing this. Let's try another one. Maybe people have their own, and that's probably good.
So what are you, when that happens, are you seeing like a blank face or confusion, or what are you seeing there when you...
Yeah, eyeballs rolling, and people are starting to.
Yeah.
Where,
So I mean, this is an important thing, I think, for therapists to hear. So obviously this podcast is, we're recording these in the hope that we can help some people feel a bit more confident and competent in front of their patients, and be able to help them. So there are times when, even though, Bart, you haven't said it, but, you've been thinking about language and metaphor in relation to pain for a long time. Did you do your master's thesis on it as well?
yeah, indeed.
So you've got a good long history of thinking about it, and it can still not go perfectly, and you need to accept that and own up to it, and probably do that fairly quickly, I would
And
imagine.
it's not an objective to create a metaphor for this patient. It's very helpful if you can just let that be, right? So just being there, comfortable in the story that patients bring, and see if there's explanation required, then it has to be something that is part of the treatment. And people have very specific questions around, and if people don't have questions around, I'm totally fine with this. I do get it. I got my understanding of this. Why would you bring up new information that is actually only going to make things more complex? Even though the explanation which is available at that stage may not even like 100% sufficient, but at least has a good starting point for treatment. Only if it's gonna if you're gonna just very simple. I think education has and metaphors do serve a purpose when you see there is a gap between your thinking and the patient's thinking. You're different worlds. You're trying to connect them, and I think the metaphor can bridge that. But it could also widen this up. So, and I think that even at any stage of therapy, there's a risk of losing the engagement by using the wrong language. But there's a lot of gut feeling there. You can see it. It's just, I do get during courses for Explain Pain, but also other chats with other clinicians. We see, yeah, there's a lot of things. It just pops out, right? You're not going to bring something that it will be refuted anyways. so you're cautious and well experienced to basically predict what is acceptable and what's not. And sometimes you just have to push it a bit more.
Yeah. And then yeah, just thinking about the qualities that we're aiming for then. So if you're giving someone back new language, or you're helping to get them to shape or recognize the language that they've already got, that might be helpful. What is the help that we're really looking at? Is it like we talked about sort of fear, and I'm guessing a counterpart to that might be safety, and you talked about body perception changes as well, and I'm wondering about body ownership and taking back ownership of that, and so is there anything else that you're deliberately thinking about? Sorry, I can probably help out, because I'm just thinking, like, if I'm thinking about the recent people, is if someone's coming for a quick fix, and that's understandable. There's like, I want someone else to do it, and being able to give agency back to them, or maybe taking agency away from pain in order to do that might be helpful, and expanding some possibilities and opportunities in life. We've used those phrases in the past, haven't we? Of allowing them to start to explore the world.
Yeah, and it's from a therapeutic approach, or at least when you're listening to patients, and they also expect you to respond to their metaphor. So if they use a specific narrative and it sounds like super dramatic, like. And then I say super dramatic is like, is this us? I'm going to die from this. This is going to be terrible. Nothing's going to work. And from let's say, if it would be a friend, you say, oh shit, that sounds awful. As a clinician, you would say, what do you mean by this? What is it actually what driving you? Why you're here when you think it's not going to work? So I think there's also a role of trying to understand that language instead of moving with and even bring up new metaphors that make it even worse. So one of those examples that we sometimes hear, what I find somewhat funny but also tragic, is that the person comes in and say, oh, it's so bad. My arm is doing this, and it feels like electricity. And then the metaphor on top of it by the clinician said, is it like ants walking through your arm? Oh yeah, that's it. It's actually ants. It's not electricity, it's ants. Where we just provide new metaphors, basically not necessarily helpful, I would say. So it's extending more metaphor, giving more language how bad it is, but it's not going to give you more information. It's probably also not helpful. I would say in more manual therapy approach, it would say it's like a nut, or it's like, I can feel the nut. It's over there. Well, it's nothing like that. Even from neurophysiology is not going to tell you it's like literally not, but this is where people are and trying to unravel, or I'm not sure what's going to happen by then, but you can see also adding unhelpful metaphorical language can also be another challenge later in the stage.
Yeah.
Yeah, yeah.
So you're not untying the knot then?
You could think about how you could do that. It's probably
Yeah.
not by doing what you've done, but
Yeah.
I can
Yeah.
see there's a problem in itself, whereas we should not provide new unhelpful metaphors are there when they already having one. Just leave it there and explore it rather than bringing your own preferable metaphors. And I think probably we're biased towards what we do, right? So if you're a manual therapist and you do a lot of stretching, or you do yoga or Pilates, it's very likely that you bring up metaphors that actually are, let's say, curable or by your therapy. I think is a good way of reflecting what is my preferable metaphorical language, and you will find out that it's highly biased towards what you are actually gonna provide for the patient, or potentially can provide.
That's a nice place to stop, I think. So,
Yeah.
yeah, wandering around our biases and how our language just bias what we're likely to do and how we work. Yeah, first of all, if you're listening at this point, thank you for sticking with us, and come on in. If you're not already part of the LePub community, come and join us. There's a free membership, and there's also our paid premium membership. So we'd love to have you on board. We've got a couple of talks and science sessions coming up. The latest ones that I'm recording are around sleep in the therapy. Sorry, not sleep, breath work, functional breathing. I'm on the next one already. Right.
That's a good cliffhanger.
Yeah. Sorry, right. There we go. Spoiler alert. And then just thinking about our session, we opened up the idea of language and narrative and story, and how we, create a space for that to begin with. You were talking about the skill of an open question, but also being able to direct that as well, and focus in on some of the things that you're hearing as well that are important, and at times that when it does seem a bit chaotic, being able to bring someone to some sort of semblance of organization as well within that, although that might tell something about itself. And then we started dropping into the notion of metaphors, and we were saying about language as a way of being able to express and share the experience that is very, very difficult for someone else to understand. And language and expression are one way that we can do that. So, giving someone the time to do that, and being able to validate the language that they're doing is a skill in itself. And then we started, going down into sort of finer detail about the use of language. Maybe it would be using that person's own metaphor that they're using to make sense. It might be quite a descriptive metaphor about the experience, like something's burning and stabbing and things like that. And then it might be about the metaphor that's allowing us to understand what they're going through. And I've done everything I can. I'm just fighting. It feels like I'm under attack. And so, like, there's stuff that we can sort of use to give us a better sense of what they're going through. And then some of the metaphors that we can work with and give back. And the summary that I've got is that, that is about something that's going to empower that person as well, isn't it? Of creating the condition that allows full recovery to be possible. And whatever it is within that is something that the two of you are going to shape together as well. And we didn't really go into this, but I'm betting that there are people listening that will be metaphors that you hear in the clinic, and it just makes you a little bit queasy. So perhaps you can drop in the comments some of your favorite or least favorite metaphors that you've heard. But thanks for sticking with us, and we will see you next time.
Thank you so much.